In the UK's health and social care sector, effectively supporting individuals with autism spectrum disorder, ASD, necessitates a collaborative approach. In an article by the National Autistic Society, approximately 1 in 100 people in the UK are on the autism spectrum. However, it's crucial to recognize that this statistic predominantly accounts for diagnosed cases, potentially overlooking a significant number of undiagnosed individuals, especially amongst adults. Historically, a lack of awareness and understanding surrounding autism has resulted in many adults not receiving a diagnosis during childhood. This oversight presents challenges in accessing appropriate support and services in later life. However, in the past decade, due to initiatives such as the Oliver McGowan Mandatory Training on Learning Disability and Autism, which is a statutory requirement introduced by the Health and Social Care Act 2022. This states that regulated service providers must ensure their staff receive learning disability and autism training appropriate to their role. The positive behavioral support, also known as PBS approach, is a person-centered framework used to understand and address challenging behaviors exhibited by individuals with autism and other developmental disabilities. There has been significant progress in outreach, delivery of care, support, screening, and reducing the stigma associated with autism diagnosis. Nevertheless, it remains imperative to intensify efforts aimed at enhancing awareness and understanding of autism among healthcare professionals and the general public. Welcome back to the Health and Social Care Business Podcast, and today we're shifting our focus to autism spectrum disorder, also known as ASD. Our discussion today will be on improving care and support for individuals with ASD. Joining us today is an impact-driven guest called Charlotte Dick. Charlotte Dick, who has taken on the role as an advocate in autism, is a mother of two on the autism spectrum. She plays an active part in her community, reaching out to parents from minority groups with children and special educational needs, also known as SEN, to access services and provide supports. She's also a director at Black Women in Care and sits on the Healthcare Advisory Board, empowering, teaching, mentoring, and helping the next generation of Black women in health and social care to reach their full potential. So, hi, Charlotte. We're very excited to have you on our podcast today. Thank you for gracing us with your presence.
Hi, good evening, Obi. Thank you for having me today. I'm really excited to be part of your podcast. It's an honor to be asked or invited to a podcast. This is my first podcast, so thank you for giving me this opportunity.
So, Charlotte, could you tell us about your most recent initiative in the autism space?
So, so recently I had a trip to Ghana. Before my trip, actually, my husband went to Ghana and he was talking about how wonderful it was. We knew for a very long time we wanted to do something to do with autism in West Africa. So, it was the golden opportunity when he went there, saw what was happening with people living with autism, just the, not having access to services. And it just really was a disparity in care. So I went over to Ghana last year with my children, took my children along. That was a challenge in itself. And we set up Autism Circle of Support, which is a non-governmental organization, so an NGO. So the aim or the vision is that we ensure that there is no disparity in care or education, and every person living with autism reaches their full potential and is able to live as independently as possible and give back to the community. So it's really focused around autism awareness with schools, in organizations, and we will be setting up an independent living skills center, which
Wow.
in Ghana. So we have plans, and it's all set and approved. More so, just now we're kind of waiting for funds. So yeah, it's getting there slowly, but surely. It's a journey, I guess.
That's amazing. So before your adventure into Ghana, you've been providing advocacy services to families here in the UK.
Yeah, so when my first son got diagnosed at 3 years old, he's now 16. It was a massive shock, as any parent with special needs child will tell you.
Course.
You know, you're going through so many different things. And I think the feeling that you feel or experience is loneliness and feeling isolated. So I wanted to change that. I set up a group, I think at the time it was called like Modern Autism Mums. And it was focused around kind of building that kind of network community to support each other. Started coffee meetings or coffee and tea meetings, which we would go out and meet up at a cafe, have a chat. And then it kind of grew into supporting people, giving them advice. I was somebody, and I am still somebody, who likes to look at where is the support, research. And we're talking about a little while ago when it wasn't as easily accessible as using Google. So yeah, it's been, using that opportunity to provide that support here internationally. I've met people through Facebook, social media. They've been asking me about, what I'm doing.
That's brilliant.
I've been offering advice, support, also sending equipment and things like that when I can. So yeah, it's just been done out of goodwill, really. And it's good. It's transpiring into more, which is great.
That's really great. You're doing great work, and that's why we have you on here to shed some more lights and give us insights so other providers, other moms and carers can learn from your personal experience and from your professional experience as well. So in our introduction, we highlighted underdiagnosis of autism in adults. Can you share a specific example from your experience where better awareness or early diagnosis would have improved care for an autistic individual? Perhaps maybe someone else's experience, because you mentioned that you're part of a group where you yourself and other moms as well come together.
So I think probably when you're in the world of autism, and you generally start mixing with other mums who have children with autism, adults or young children, you start to notice that really the system just is not fit for purpose. The diagnosis process takes very, very long. There's adults living with autism who were diagnosed much later on in life. I'd say that is probably more so because there wasn't the awareness of what was going on. Parents not understanding what the symptoms are or what the characteristics of autism are. I would say more so in ethnic minorities, so Black and Asian communities, or people of color, and that's usually down to a number of things, culture, etc. But I would say that they're looking at a specific example. I'm just trying to think. I know I can say not an adult, but I can say as a child, which I think still would be relevant as an adult. I know a woman who has 3 children on the spectrum.
Okay.
And then she has had another child who was a daughter, but this daughter was very, very high functioning. And we try not to use that term high functioning now, but you know what I'm talking about. So she, academically was excelling, doing really well at school, but she noticed that she was really struggling socially. She was verbal, she is verbal, has very good speech, but was really struggling with the lack of any change in routine, would have huge meltdowns when she came home. And so, she had to really fight to get her diagnosed. Even though she had children with autism, she knew the symptoms and was telling professionals. It's about, I think, as well as awareness, about making sure that professionals listen to the parents, listen to the person that knows that adult or that child best. So, I think with improvement, yes, awareness is for parents. So when we're talking about adults who may need to, their parents could have known that they were autistic when they were younger, and also adults knowing, that they have characteristics of autism. We're also talking about professionals not understanding or not picking up on what parents are saying and dismissing them, especially people of color often. Um, and I did my dissertation around the challenges of people who are Black, Asian, and minority ethnic groups in with getting support with learning disabilities, and understanding and navigating the system. And it was really nothing surprising, for me anyway, that people didn't trust the system, because they wasn't listened to or not heard. So it's there with awareness things get better, but there's always going to be barriers, no matter what, and yeah, it's improvement on both sides, so awareness and also professionals.
Brilliant. How can we improve public education and awareness campaigns about autism to ensure more inclusive and understanding environment for autistic individuals across all age groups?
We obviously have the initiative of having a World Autism Awareness Day, which is the 2nd of April. It's also celebrated as Autism Awareness Month for April, the whole month of April. So there's campaigns like that, and that is done globally. It's recognized by the World Health Organization, and every year has a different theme. So this year was Thriving, Not Just Surviving.
Yeah.
So more recently,
participated in that too.
Oh, good, excellent. See, so it's doing what it has to do. But I would say is, the only problem is with that is when you're doing something like any awareness, regardless of whether it's for autism or any other condition, mental health, etc. It is that we have that month and then people forget about it. So, but how do we keep that momentum?
Yeah, the consistency.
Exactly. My kind of group of parents is to continue what we're doing. So let's not lose that momentum. We're talking about awareness, but it's about acceptance. So even though people have that awareness within, the public environment and with education, and people go on courses, it's about acceptance. How do we ensure that people are accepted into society and they are included as just everyday business? It's still a challenge, in every area. So within education to social and healthcare, within healthcare settings, it's still a challenge. I think it would be to have a, parent or patient participation groups, which they already have, but as well going down into the communities. So those hard to reach communities don't get access, and then that's the problem. So we have the awareness, but if you look at research, there's still not that awareness of why there is a barrier still within minority ethnic groups in kind of.
Yeah, I also feel with service providers as well, they possibly could play a part in continuous awareness. So service providers have the means to create autism awareness days. So we don't have to wait for World Autism Awareness Day. Service providers could also be encouraged, especially those that particularly provide autism support. They could do things within the local community to constantly discuss and raise awareness of autism. And I like what you said about acceptance. So if acceptance is key, then continuously talking about it and making people in the community aware is eventually going to lead to that, because then it's not going to become a norm.
Yeah,
so,
definitely.
So what resources or support systems can be developed to empower families to advocate for their autistic loved ones within the healthcare system? And I know that this is probably an area that you have a lot of experience in, because you may have even had to do this yourself.
So what I would say about this is, the reason why I laugh is because there is loads of resources out there. The issue is implementation.
Okay.
And actually people knowing that those resources are available to them. So there is something. So when you're in something like, if you go, for instance, if somebody's in a social care setting and going into hospital, I think it's goodness, what is it called? It's a passport. So it's basically like a passport of what that person likes, how that person communicates, all different things about the person. They have one for dementia, and they also have, I think it's called a learning disabilities passport. and it's called many different things in many different services, but it is something that's supposed to be transferable between, different settings, which is key. That's just one thing that you could use. So it's there within the healthcare system. It's not used, so I can say that nobody's ever offered me that. I know it's there. At the moment, I can advocate for my child or my children, but my eldest son is 16, and soon he'll want to advocate for, or want to be empowered to be able to advocate for himself. There is limitations, with his understanding and capacity, etc. But I think it's knowing. So I don't think we need more resources. I think have the resources there. I think it's about making sure that people are aware of what's there. And reviewing, is it fit for purpose? How do we use it? And making sure that it's used. If it's not, then it's reviewed and it's updated. Also that it's accessible to people of all languages.
Yes, that's very key. Communication, reducing any communication barriers.
Exactly.
Yeah.
It's maybe publicizing it in areas that it wouldn't normally be. So for instance, in social care, where somebody is going to have probably more interaction on a daily basis with a carer, or be living in a residential home, etc., or supported living, they're going to have they're going to have more daily input with that person. They should be the ones that's supporting with those resources that may be used. I don't know, easy reads if they're going to have an operation, can an easy read format, and they're available. They have to be legally good practice on those healthcare websites, so on NHS websites, etc.
Available. So perhaps they could also look at innovative ways of delivering autism support, which could be centered around implementation. So this is good for service providers to know. So to improve the autism community, there are things that already exist that it could use to provide a better service, and also to contribute to the awareness, growth, training, and all the things centered around autism. So that's a really good point. Thank you for sharing that. So for individuals who opt out of receiving home care, or who receive limited hours of support, or whose family have just been diagnosed, what training programs or workshops are available to offer these families to help them better understand and support their autistic loved ones at home, particularly in managing mental health challenges and behaviors that challenge?
There's training programs. So there's two elements to this question. So when we're talking about somebody who is not really engaging, and have just had a diagnosis, especially when it's something to like autism, if the family doesn't want to engage, especially if it's a child, then they are protected under certain legislations, and the family will need to engage. Otherwise, automatically it starts to become a safeguarding.
Could you just repeat that again? Because there might be someone who might benefit from that. It's because I know accepting that your child has been diagnosed can be a very difficult process. So for parents who are especially struggling, so where does the line end when it becomes a safeguarding issue? Because if you don't know, and if you're not learning and equipping yourself to support this child, and they will refuse home care, where does it become a safeguarding issue? Sorry to interrupt.
No, it's fine. So when you're looking at children in particular, so when we talk about children, we're talking about anybody under the age of 18 legally. That's defined as child under the Children's Act. A child will be under responsibility of the parent, but the parent needs to ensure that they're acting in the child's best interest. So anything like a child who has maybe a social communication delay or a learning disability such as autism, if they believe that this child has autism or has just been diagnosed, and they're looking at what support can be offered to ensure that that child is receiving the best support that they can, then you need to be ensuring that you are engaging with the professionals. You're going to have loads of professionals. It is overwhelming, but they have to understand there is a legal obligation for professionals to ensure that that child is safe, and that child you are acting in the best interest of that child. And so and then after, when you start disengaging and not having any support, then they will start looking at whether that child needs to be safeguarded. I'm not saying don't want anyone to start panicking, but that what you need to start thinking about, why you're not engaging, what's the barriers, if it's to do with you're scared, it's natural, that's a natural reaction.
But so would you say communication, then speaking out as a parent whose child has just recently, or family member has just recently been diagnosed with ASD. And again, with regards to the interventions, are there any specific training programs that they could actually look into? Are there any that you could actually recommend for individuals or for families to go to right now to learn?
For training, what I would say is go onto the National Autistic Society for anyone that's in the UK. That's the first, point of call. It's a charity, but you're going to find loads of information. I would also say, if you're on social media, you can go on social media. You'll be offered training if you're in the UK and your child is diagnosed. You will be offered parent training around autism. Waiting lists are crazy. So you may wait a while, especially if your child is having behavioral problems. You might be referred to something like CAMS, which is the Children and Adolescents Mental Health Service. And the waiting lists are, unfortunately, like a year or more just to be seen.
Oh, wow.
Yeah, they are, there's just not enough. They can't keep up with the demand. We're not just talking about children with autism, but we're talking about children
Adults as well.
children in general, so who might be accessing any mental health services, and with COVID it made it worse. So going back to the training, I would say look at things like National Autistic Society, and also speak to your GP or your doctor, in primary care. What resources can they refer you on to? I don't want to name any specific website, but I would say, go on to social media, start making those connections and those groups. I think more than training, it's more about making sure that you've got a support network. Just going from experience, it's just making sure you've got another parent to validate how you're feeling, and ask questions. That's the easiest way to learn than reading off any kind of website or book, etc.
Oh, so you would suggest, based on the waiting times, something that parents could start doing straight away is joining groups and learning from individuals with lived experiences, because that's
Yeah.
easy. You could just engage social media, and you could even look at previous interactions to learn one or two things online, especially on places like Facebook or groups like Facebook. And
so I've got where I'm on Facebook to share my children's journey, and just a kind of a blog. Facebook is a good platform. I'd say Instagram as well is a really good platform to go on. But you also got to be careful. You have to remember that those are just people's opinions sometimes,
yeah,
factual. So make sure that if you have any concerns, you speak to a health professional, and you're not going by what somebody says on social media, because you get all types of people on social media.
Okay. So you mentioned the long waiting times, and the long waiting times. So based on your individual experiences, can we discuss specific improvements in healthcare policies or service delivery models that could lead to autistic individuals getting access to better care?
I don't think so at the moment. I think a lot to do with what we're receiving is because of the government that we have in. I don't like to say, but I think the things may change. I don't want to bring politics into this, but
okay,
a lot of things are not happening at the moment that should be. So I think the waiting times are ridiculous. So the waiting times on average for a child to get diagnosed with autism, so that's for it to go to have a social communication assessment with a pediatrician, is probably about 18 months to 2 years. And that's just to be assessed. So we're not talking, in autism, the most important thing is early intervention. So you might hear that thrown around a lot in the autism world.
But rightly so too, based on what you've just said.
So we're talking about things like access to speech and language, which yes, you can get in the community, but it's about making sure that child has a tailored plan, which they have the educational healthcare plan, which is what is in legislation that children must have, and I think it's in the oh goodness, you're getting me in my legislation. Family and carers, the child should have an education, care and health plan, which makes sure that the child has all their needs met. This is in social care, this is in healthcare, and this is within education. So it means that it's kind of a coordinated approach to making sure that you're fulfilling that autistic individual's needs. And it is in place until the person is 25 years old. And this is in the UK. So anybody listening that's not in the UK, this is in the UK only. I know that there's similar things within the US, and I'm not sure what is actually available in the other parts of the world. But that is there. There is now, and I don't know if you've heard about this, they are now putting a hold or trying to reduce the amount of those plans that they authorize. So no matter if that child has a diagnosis of autism or especially the government is trying to reduce the amount of those plans that come out, because those plans equalize to money in a sense of if all of those needs are met within school, within healthcare, within college, whatever setting they are in, it will equate to funding for that from a local authority. So loads of policies in place, loads of legislation in place. It just needs to, it needs to be implemented. It should be, smooth, and there shouldn't be any barriers to people accessing what they're entitled to live just, a normal life, as we say, quote,
So
normal life.
Thank you so much for sharing that, Charlotte. So whilst providers, because it's quite shocking to hear that the waiting time to have an assessment, it's on average 2 years. So are they, from your experience, are there anything or is there anything providers within the community could do in that period, or do you just wait?
Yeah, so I would say if you're a provider, it would be if you're supporting somebody who may be displaying characteristics of autism, and this, and you're trying to support that person or their family, it would be looking at, I'd say, third sector, so looking at the charities, what can provide. So you'll have places that will be willing to support, but there's also things that you can get without actually having a diagnosis. So it doesn't mean that you can't get support. So things like speech and language or occupational therapy, or access to any kind of art therapies or extra therapies, holistic therapies. It is just looking at what's out there. I would say if you're really struggling, it would be the GP is the first point of call. That is the person who coordinates everything, really. And they can say to you, okay, well, we can still make a referral to speech and language, even though this person doesn't have, a diagnosis. And I think that somebody who's a provider being there and having close access to the GP, I've always felt is important. Even, not me as a parent, but as a professional, I think it's really frustrating when people are not working in partnership, and especially somebody, provider who's a provider from kind of social care, than a GP who may see this person, once or twice a year. This is the person who, may be seeing this individual on a daily basis, and can help to kind of give more of an insight into that person's needs. So yeah.
This also brings us to the next question, which is how can collaborations between different sectors, I know you previously mentioned the third sector, sectors such as healthcare, education, social care, create a more seamless and comprehensive support system for autistic individuals?
At the moment, they are supposed to be. So they're supposed to be doing that as business as usual, really. In the real world, it doesn't happen. It's systems, really. So, you've got loads of different IT systems, for instance, with information about one individual. They don't speak to each other. We know that. It's very difficult to get because of, GDPR and security and, all those, loads of different things. But I want to know that I don't have to go to every single, appointment and have
Repeating
to
yourself.
Myself, because it is like, it's so tiring. It's tiring for me as a parent. I have 2 children, and then I get so I think that if people were thinking about not just their intervention or the support that they're providing, and they were thinking about the impact on the individual and their family, they would be thinking about how can I make this more seamless for this person, how can I make it more easier for them to access the service without having to repeat themselves or us missing information. Sometimes you go to an appointment and they're just reading your referral letter and you're thinking you've had maybe 18 months to do that.
I'd just like to reiterate what you said about the third sector. For individuals who are looking or feel stuck. The third sector is always so many charity organizations people could reach out to for short-term support. Yeah, I guess I just wanted to reiterate that just in case some people were looking for things that they could do, because it sounds like the time between even past assessments, there are still areas for improvement, and to reduce the frustration on your end and the burden. And whilst we still wait for all the different sectors to collaborate seamlessly and create a centralized database, making connections to charity organizations within your local authority, would you say is a good way to just keep that constant support going?
Yeah, definitely. Third sector is always a good way. You never know what access you have to different funds. There's loads of different charities providing funds for equipment, even if it's for, a respite, holiday, even to get your garden made into a sensory garden. There's all sorts of services out there which are provided by third sector charities and not provided by the local authority. But it's definitely good resource to use.
Brilliant. Thank you so much, Charlotte. That's the end of the first segment. Thank you so much, Charlotte, for your time. Thank you for sharing your insights and experiences with us today. Your dedication to providing the best care possible for autistic individuals is truly inspiring. And to anyone who is listening, whether you're a service provider or a service user, we hope you'll be eager to implement some of these key takeaways in your work and your family's lives. Thank you.